Hello, my name is Keely Booth. I'm a board-certified anesthesiologist. I'm the chairman of Integris Health, Integris Southwest Medical Center in Oklahoma City. I'm also the president and founder of the Advanced Perioperative Services, which is a clinical management anesthesiology group, and also the founder and creator of Surgery Logistics, which is a solution or results-oriented product designed to help operating rooms perform better and deliver enhanced levels of care to their patients in the most effective and cost-effective and efficient manner possible. My story begins with regards to my interest in improving operations and efficiency well back into even high school, and I've always had a tendency to break things down into manageable processes. And then as I pushed through into college, I really understood technology was beginning to revolutionize the way people access information, the way they use it in their daily work, in your education. And then I got into medical school, and it was really no different. I understood that technology was revolutionizing everything around me, and through the decade of the 90s, during which I attained my undergraduate degrees in biology, chemistry, and then ultimately went on to medical school, the internet boom ensued during that period. I was basically interested again in how could we leverage technology, computers, the internet in particular, to really advance the knowledge base of not only the clinicians but even patients. And that's when I actually got into projects that began to develop software to help physicians use handheld computers. And I started a company by the name of handheldmed.com when I was a second-year medical student at the University of Oklahoma College of Medicine. We ultimately went on and joined forces with yet another startup and attained the largest medical library available for handheld computers. So as of 1999, we actually had over 60 different medical textbooks available that clinicians, medical students, resident physicians, nurses could actually download and carry with them. And so that was very early in the game of mobile technology. I set up one of the first residency portals for anesthesia, actually the first at the University of Oklahoma College of Medicine for anesthesiology. It acted as a resource for residents, and that was what I built while I was a senior level resident with the program. And then I moved on and graduated from residency with ideas about the inefficiencies that exist within the operating room. The operating room is a very complex environment. It's an environment that is plagued with difficulties because it takes so many resources and processes to be lined up in such a particular order that if any one of those doesn't occur at the point that it's supposed to, it throws the entire process off track. And the average hospital receives over 60% of its revenues from perioperative care or surgical care related to that department. So you can understand that literally hundreds of billions of dollars in healthcare are at stake when you look at the surgery department. And being able to make that department more effective and more efficient is absolutely a cornerstone of moving our healthcare system into the future. So Surgery Logistics really offers you as an end user of the application a way to communicate in a seamless and effective manner with other counterparts that are all trying to achieve the same goal, which is ultimately the safe and effective surgical care of a particular patient. The way we do that, we actually take data elements that we've defined that is critical to the process of actually getting the care, and we actually collect that information and share it in a seamless manner. In a matter of seconds, we can actually communicate with everyone in our care environment as well as people off-site. That's where, literally from the moment the patients walk in the door, we have problems in healthcare. And it's what I came to refer to as the logistics of the healthcare environment. And it's something that is largely ignored in the overwhelming majority of facilities in existence in our healthcare system today. For example, often you would arrive for your surgery possibly as early as 5:30 in the morning. And we can actually begin to communicate with the anesthesiologist, with the surgeon, who may not even be in the building yet. But those individuals can be updated as to your status and your, because the patients are the most important thing, and we need to know what's happening with them at all times. And so without ever making a phone call, without ever having to receive a page or a fax, I can actually essentially follow along what's happening with the care of our patients. And the other thing is that we find that this is critical to coordination of the care. So a big part of logistics is how are we going to coordinate the staff and the resources and the materials in order to get the job done. Data can come in from many sources within the environment. It can come from a mobile phone that's carried by a nurse. It can come from a wall-mounted interface that allows another clinician or technician to put in information, a bit of knowledge that they may have about the clinical care process that's ongoing. That information is then propagated through the internet in a secure manner that allows it to be shared across all connected devices simultaneously. Surgery logistics is the same in that it can actually transmit the data in a manner in real time, in a matter of seconds, to everyone who might need to know that in a secure manner, and actually protect that information as well as share it in a really seamless manner. And so we actually are integrated with any smart mobile phone, whether you use an Android device, an iPhone, whether you use even a BlackBerry, would be able to access our system. As we are not app-based only, we are able to actually integrate, and we say we're agnostic with regards to platform. Then we also do the same thing while we're in the operating room. No one has to make a phone call, no one has to get up and physically walk down to find out what's happening. We're able to transmit this as part of the way we take care of the patients, and the people that are the managers and the administrators over these departments can really understand how they can allocate the resources. So ultimately then this carries on even into the recovery phase of care, and when you go into the recovery room and you begin to wake up from your surgery, and even out into the transition to the ICU or the transition home. And then we actually go back in using our tools and the data we've collected to analyze this information in a way that helps us benchmark our performance. We talk about the first of the morning cases. If those aren't on time, the odds are that the rest of your day gets thrown off. And what we were actually starting less than 35% of those cases on time. In 36 months, we were able to achieve an entire 12-month period where we actually started over 75% of all of the cases on time. So we more than doubled the number of surgeries that we were able to start on time. We actually decreased the overall delay on a per surgical basis by 40%. We were also able to decrease what we refer to as our turnover time, so the time between surgeries was reduced by approximately 25%. And these are all metrics that people really, you can understand the impact of when you're in the environment, and you can feel the palpable change, and we've really totally altered the expectations of the clinicians in the department, and the high level of quality of service that we're able to provide to our patients. We speak to that in terms of the training, and it's so intuitive that I often get comments, people say, well, that's it? And I say, yes, that's it. And I take it as a compliment when they say that, because they have no idea really of what it took to get it that simple, so that it didn't interfere with their day, but it actually augmented their day. And so I ask for each individual user of surgery logistics, if you can give me a few seconds, I'll give you back minutes of your day, in some cases hours. My relationship with the Business Development Center began in early 2011 when I became a tenant at the Penn Campus Business Development Center. And since that time, there's been a lot of transitions and focus for me in redeveloping and redefining and raising the bar for surgery logistics and what it could actually bring to the table. I would say having essentially business experts literally on site on a day-to-day who can actually help consult with you in anything from legal matters to banking and funding matters to helping with PR and marketing is tremendously helpful. The BDC offers its tenants a great opportunity to economically pursue the development of a business. There are a number of incentives at the state and federal levels that they offer you. There are a tremendous amount of opportunities in terms of furthering your education, if that's what you need in a particular area, connecting you with qualified people, help recruiting and building a team. They can help with all of those things, as well as an extended and wide network throughout the state and even into other states of connections that they have with developing a means to fund your projects, a means to get in front of people who may be interested in actually seeing what you have to offer. The lab space is really about connecting with people and helping them understand the vision of surgery logistics. It's one thing to use your imagination to try to understand what it is we do and what we provide. It's another to put you in that environment and really show you how things work. And this really gives you a much better sense, because many of the people involved in making decisions about implementation of these kinds of tools are administrators or business background, business-minded people that don't have the clinical experience or full appreciation of how these environments are impacted. The other thing we're able to do is actually show our clinician counterparts that we understand their environment very well, enough to be able to recreate it in full scale. And so that's very helpful to us. And so we come in, and this is an environment, while to the overwhelming majority of the population is very foreign, to me this is where I live. And so we've created an environment for you to come into, and you can actually experience our solutions, our offerings, and our methodologies in real time. And that really helps bridge the knowledge gap and understand why what we're doing is so important. So within the surgical logistics OR lab environment, we're able to actually allow people to come in and interact, and you can actually assume the role of a patient, you can assume the role of a nurse, a physician, a clinician, anyone within the care environment, and you can actually understand how the flow of data, the communication processes, and the methodologies would impact you personally from that perspective. And so it really gives people an opportunity to role play and understand. As a physician, I have an opportunity to really understand and observe how a nurse may be impacted, how my patients may be impacted by this. And so really is a very flexible world we've created in essence to show what is happening and give you time to pause, fast forward, and rewind to really look into it in great detail with a realistic recreation of a real world operating room environment. The patients need this. They expect it, they want it, and if we're going to move our healthcare system into the future, we have to explore these concepts on all fronts. And unfortunately, medicine is traditionally relatively slow to pick up on new advances, contrary to popular belief. Sure, we have many diagnostic tools and clinical tools that are very advanced and among the most advanced in any industry, but it's how we deploy everyday technology to change the business and the operational management of our clinical environments that is really behind. And that's my goal, is to push that forward, because that's the common interface, the friction point that we have when we deal with our patients and we're trying to deliver care. I honestly believe that a facility that adopts surgery logistics understands the need for a focus on the patients. And that's why I'm so proud of surgery logistics and what we've been able to achieve. And I realized long ago that we're able to touch many more lives. Although I am a physician and I work directly with patients, and I do all of the time still provide clinical care, I never want to lose that perspective as a clinician. But I realize that I can touch many more lives with surgery logistics. People that I may have never met will benefit from the work that we do here. And that's something to me that's very important, and provides an extra incentive and allows me to be far more passionate about what we're doing here at Surgery Logistics and what we're going to deliver to literally the global medical community.